you said? You gotta sleep.
There's no sleeping when you're a public servant.
Yeah, did you get my email last night? Mark,
Yes.
did you get my apologetic email last night to everybody?
Yes. What it didn't include was how everything turned out, whether they were pissed
Oh,
off.
no, they're there till Friday. Oh, no, they were so angry. They were like a hornet's web when I got there.
Oh dear.
I got to be honest, I was a little bit nervous about it, so I left. I left the meeting and hightailed it up there. And
Yeah. I like the mixed metaphor, a hornet's web. It's good.
oh, you're too funny.
I should be a state inspector or something.
I go.
Well, I hope that goes well.
I said, can I bring you coffee? Are we allowed to talk to you? Are we, how does this work? And they just grunted. They just grunted at me.
A foot massage, perhaps. Can you still work that way?
Yeah. Good morning. Yeah, Jake, we had our pop inspection for our recertification, and so they call and they say, you got 20 minutes to get to the office. We said, we're here, no problem. So they call us like right at 9 o'clock sharp and they say, where are you? Well, where are you? They went to our old office. I said, our license says the new office, it's 45 minutes. So all three of the inspectors are like fume coming out of their ears. They just walked in with a chip on their shoulder. I'm just like, this is not the way to start your recertification.
All of our Karens right here.
And I didn't realize that, I say, hey, you know what? We bought the company back in February. How tough can this be? Sir, we'll be here through Friday evening. I'm just like, are you kidding me? So this is just like, and it was as the board meeting was starting yesterday, my phone's blowing up, I mean, literally blowing up, 911, 911. I'm just like, hey guys, what's so important? I mean, is a building on fire? Worse, state's on their way and they went to the wrong office. I'm just like, how'd they go to the wrong office?
We'll just reset.
Who knows?
You guys screwed it up. I'm not gonna lie.
Too funny, man. Welcome to the COVID world. I went right onto that Palmetto Medicare site and the governing body, and it says Carpentersville right there. And the inspector goes, I have no idea how we got Willowbrook. I said, but we were in Willowbrook, years ago. That's the company we bought. And she goes, dude, it's right here. I was like, I am so sorry. It was horrible. It was,
Did everything work out on the other conversation we had last week in regards to all that?
yes, that went remarkably well. Thank you.
Good, you're
Yes,
welcome.
remarkably well.
Good, I'm glad.
Although again, when you're, at the top of the food chain, sometimes I am the most hated man in the company.
Well, you're not there to be popular, you're there to do the right
Just
thing.
like-
That's what I always say. Sometimes when you do the right thing, you're not popular.
You know what? There are days when you say, no, I just want to go wash dishes again. I'm
Yeah, yeah, but remember that.
How do I not do that?
I did not. Okay, sure.
Did you ever try washing dishes, Cliff?
Hey, buddy, my entire family grew up in St. Charles, so Salerno's on the Fox was our training ground.
You remember when Fox Valley Mall had no stores in between, just Marshall Fields at one end and Sears at the other?
Surely do. Yep.
One of my earlier jobs was in the Sears cafeteria as a dishwasher.
Dude, no, we were Joseph Spies and
Oh, Joseph Speed.
Oh, yeah, yeah.
Favorite.
Right
And
here.
Ackerman's in Elgin.
yep, and then everybody, we all were busboys at Salerno's.
Oh my God, I worked at Joseph Speed's when I was a girl.
Sorry.
Is Treese with us? Mark's here. How about John or Anita? Or give us a quorum.
Leonard, Allen.
Only one online.
Travis. Yeah, we've got a quorum.
Ferrero's on. That's a quorum.
Good.
All right, it being the hour of 9 o'clock, let's go ahead and start the October 14th, 2020 Kane County Human Services Committee. Give us 1 second, we're going to call roll.
Allen,
Present.
Ferrero. Ferrero here. Davis,
Davis here.
O'Shea. Lewis. Leonard.
Here.
Burgess here. Okay, and this morning I am working without the benefit of a red lined sheet. So when it comes to voting and aye or nay, I'm going to fumble a little bit. I just want to acknowledge that. So, and Debbie, look at me because without the little red lines, I forget which vote is supposed to go which way. So, approval of minutes from the September 9th, 2020 meeting. Bill, second by Deb. Any conversation on that? I do not know if this is roll call or all in favor. Roll call it is.
Allen.
Aye.
Ferrero. Davis.
Davis, yes.
O'Shea. Lewis. Leonard.
Yes.
Burgess.
Yes. Therese, are you with us?
He's on mute.
He's muted, okay. I don't believe we have anybody in the audience for public comment. Anybody online? Okay. Monthly financials, I believe, are attached for your review. Jake, Veteran Assistance Commission.
Thank you. Good morning. For the month of August, average veterans disability claim took about 5 days longer than the average Illinois veterans, with our pension claims taking over a month shorter than the average Illinois veterans. We kind of looked into that to see why ours are taking longer. We couldn't come up with a real great answer because we don't see what the VA's claims are that are getting decided. They just give us the number there at the end. So we're continuing to look at that, hope to drive that number down, get it below the average Illinois veterans. Total claims pending in the state of Illinois, 10,369, with 142 of those belonging to us. 21 claims filed for disability compensation, 2 for pension, 10 applications for VA healthcare, and 5 appeals in the month of August, with 153 forms completed total. Our clients received $285,000 in new benefits in the month of August, bringing our fiscal year to date total over $3 million in new benefits for Kane County veterans. That concludes my report, and I'd be happy to take any questions that you might have.
Jake, my initial question, how do the upcoming holidays affect, like the Thanksgiving being a short month and stuff like that? Does that have an impact on your?
Yeah, it certainly does. And any day where we're not, we don't have staff actually working on claims, it would affect productivity. If you're referencing the earlier statistic, I don't think any holidays took into account for that.
Okay. Okay, thank you. Any other questions for Jake?
Thank you.
Okay, moving on. Sylvia, Human Resources?
There was the monthly financial reports. I don't know if anybody's on the call.
No, we said they were on file.
Okay. So we have the monthly Blue Cross Blue Shield invoice, which is $1,336,96. We are still waiting to hear from IPBC. Michael Baker and I had reached out to them. Their final audit for our projected refund of $650,000 is yet to be confirmed. But they said they do their final audit in November. So Michael Baker and I are waiting to hear back from them, but we're pretty confident that that's what we should be getting back from them.
Bill?
Yes, Mr. Chairman. Sylvia, I wanted to mention that I think it would probably be a good idea if at our next county board meeting, if we gave a brief summary in recognition of what Michael Baker has done over the last few years in reducing our health costs and saving the county money. I know initially when he was hired, there was concern about the $96,000 a year that we were paying him. And I think we can prove beyond a shadow of a doubt that we've gotten a return of anywhere from 3 to 10 times that amount. So I think we should at least make some recognition, if that would meet with your approval, at the next county board meeting for Michael Baker and his group and what they've done.
Okay.
And Bill, I would go, just for the record, I would go one step further, that if you're going to mention the $96,000 flat fee contract that Mike receives, the previous broker that was involved with this, I believe that his fees were well in excess of $200,000.
230,000 and more a year.
Exactly, with some additional fees involved there. So Mike has not only proven, let me rephrase that, Michael's firm and Michael have not only proven to be cost effective just from a compensation perspective, but what he's done to transform where we are and the way we were doing things before is invaluable. So I agree with that, and I would be more than happy to do that.
Thank you.
Sylvia, in terms of the Blue Cross, if I could make the generalization based on some earlier reports, during the first Q1 and Q2 of 2020, we were really doing quite well, but we were in the middle of the COVID. Nobody was having any of the elective surgeries and stuff like that. And then we were projecting that by the time we get to Q4 and everybody wants to use up all of their, incentives and flex spending and stuff like that, that we would see that ramping up. Are we seeing that? Do we anticipate that happening? Has there been any conversations on that?
There hasn't been any conversations, but you can see that there's a little bump up in this monthly settlement. But just the same, it is still quite a bit less than when we were with IPBC. So these costs have gone up a tiny bit, maybe 100,000, 150 sometimes. In this particular one, it's about 200,000 more than what you were seeing in the first quarter, but I still don't think that's a huge bump.
Is there a way to possibly quantify that other than dollars? So if healthcare costs came down, if surgeries were put off, is there a way to get a measurable count and say, in previous years, we were averaging X number of claims and actually the physical number of claims has been reduced or increased? Or
Let me see what I can do about that.
and again, I'm not asking to spend hours and hours on this. If it's a report, I would just be curious to see, I would like to see some trending for future years to see what Q4 brings year over year
Well,
compared to July, you know what I mean?
I can reach out to Heather,
Okay.
who is, of course, with Group Alternatives and is very helpful, and see if she can quantify something for us with all of the reports that she sees.
Perfect. Thank you.
And then, again, it's just data that she
Right.
gets. Okay. So MERP, we all know that we're in open enrollment, and I just want to remind everybody to make sure to go into SmartBen and elect their benefits. As you know, it was really quite timely that we moved over to an automated system with COVID, because people are able to go in with their families and elect their benefits. But you must elect your benefits, because if you do not elect your benefits, then you won't have coverage on 1/1. And we are doing our due diligence in HR, just so you know, by trying to pull as many reports from our census with all of the providers, with IMED and Cigna and Blue Cross Blue Shield, so that we can see who's covered, and then pulling reports from Smart Ben so that we can keep a track on what's being elected, so that nothing falls in the crack and we can reach out to people and say, you know, here's what we see. But just to update everybody, we have 410 who have completed the Smart Ben enrollment, so we're not very disappointed in that. We have 121 in process. That means they went into the system but didn't finish it. And we still have 682 who haven't touched it. But as you know, I hope you're getting email reminders or getting reminders on your smartphone. You're also getting reminders from us. So we're trying to make sure that nothing goes amiss in that.
Deadline on that is when?
10:30. But we are probably, just in case, going to extend it to 11:09, just to make sure that we have a window of.
And do we have a tracking or a mechanism in place to reach out more than just an email? Can we get a telephone call if there are people that hit on the last day of the month? Can we say, listen, there's 100 people, we need to make 100 calls and say, hey, we switched system if you missed that
So
email.
Nancy McGarry, who's been a temp in our department off and on, as you know, I put her solely to be on the phone, take phone calls, and be reaching out. Right now, she's reaching out to all the retirees and all the people that are on COBRA. And she will then, as we look at the reports, call out to all the folks that may not have completed it as well. So that's her whole focus.
And for anybody who hasn't walked upstairs, Nancy's kind of like the Bat Cave. She looks like Alfred. She's got her little room back there with all these computers and the hotline to call directly to her to get assistance for the Smart Ben system. And the way we've approached this, she's just been a godsend.
We tried to be as proactive so that we're not being reactive, but you know, there are still unforeseen things that are occurring that we're mitigating. So, but it's all good.
Thank you.
You're welcome.
Chris, did you have a question? And again, Mr. Kyles, congratulations.
Thank you. Just on the question about MERP, because you said everybody sign up on the Smart Ben or whatever it is, but MERP has to be done by,
So MERP is still done in paper form. So the things that are on Smart Ben are Blue Cross Blue Shield, Cigna, and IMED, and the Employee Assistance Program. The other benefits like MERP, they are still done manually, and that's another thing that will be coming directly from MERP to all the participants within MERP via US mail, because you have to provide a new attestation form every year in order to be in compliance. And that's another spreadsheet that Nancy is looking at and marking off, making sure that we're getting all the paperwork that we need. But that's just stuff that we do every year that we plan for as far as MERP is concerned. But you should be getting something in the mail.
soon because it's the end of the month that it's,
Yes, you should be getting something from them by this week. They mailed it out, they said last Friday.
thank you.
You're welcome.
And the census on it is 54 people?
Yes, sir.
Sylvia, moving on.
Okay. Job applicants, as you can see, we have been very busy with that as well. There have been 149 job applicants across the county, and we have had a total of 10 new hires, as you can see on the report. And terminations were 13 across the county. Any questions on that?
Sylvia, can you pause 1 second? Blair, are we okay? Okay. We're good?
Yeah.
I'm just making sure that we don't have a technical difficulty and we're cutting people off or anything like that. So, thank you. Sorry, Syl, go ahead.
That's okay. Any questions on that? Okay, we're going to move on to workers' compensation. I have to say that we continue to trend in the positive direction. And I have to thank CCMSI and the departments that we reach out to make sure that we're getting the right paperwork, to make sure that we're following up, that we're getting videos if it's an on-the-job injury that is lost time. And this is the effort of all of the departments. This is the effort of CCMSI and Human Services. And if you go through all of these reports, again, without going into detail, you can continue to see that we trend in the positive direction of having as little impact here as we possibly can. We want to create a safe environment so that people aren't getting injuries on the job. We work with Ricky Sparks if there's something that maintenance can do to improve something that has occurred. So this is a lot of effort. And I have to thank everyone because this is collaborative.
If I can pigtail on that just for a moment, when I first came onto the scene here as a county official, I remember sitting in some of our meetings and executive sessions and just being overwhelmed at the numbers and the claims and the quantities. And I found it to be incredibly refreshing yesterday to hear that an employee involved with something had to see our doctor, not just their doctor. And that's not, that's not to say that there wasn't an injury. It's to say that there was a counterbalance and a checks and balance system put in play that maybe wasn't here just a few years back, or being as supportive as it could be. And I know that was just a 30-second snippet yesterday, but I found that to be an extremely refreshing 30 seconds of hearing how we're changing our posture and being more assertive with these, and while still being as absolutely fair as could be to our employees and providing a benefit. So, for what it's worth, truly, this has been a cultural shift, and that's not conversation anymore. We see that in action during the reports, and yesterday was a great example of it. So, sorry.
Thank you. Any questions on any of the graphs? Okay. Then let's move on to group alternatives, the financial tracker. You can see that the amount towards reserve is $1,047,987. Are there any questions on the financial tracker? Because again, this is a great tool to help us see what the costs are and where things are. Oh, is it locked?
No, we're there. We went backwards a screen. We're good.
Okay. Any questions on that? Sexual harassment training. This, again, I have to thank IT for working with me in having this be a push for everyone to be able to access it on their computers. And we have had great participation. As you can see, we have 801 employees that have completed it, 160 who have completed the management portion of it as well. And just so you know that to be in compliance, it doesn't have to have 100% participation. We have to prove that we did our best effort. And I can assure you that this is the best effort if we were audited. The fun part is that the minute we get done with this, we have to start all over again because we have to do it every year.
How many of us have not completed it? Myself.
Maybe 200 and I think it's like 280 or something. I'm not really sure of that number, but it's about 200 and something.
And there's not a penalty for,
No, there's no penalty. You have to show good faith effort as an organization and as an employer that you did your best to make sure you were compliant. And this truly shows we are
I have 3
continuing
unread
that.
emails, and one of them is this. I will have it done this week.
You didn't finish it yet?
Not finished it yet.
Our hope is that we can get to 100%. That's always my intention, but I just wanted to assure everyone that we have proven our best faith effort.
Anything else on that, Sil?
No, sir.
Any questions? Mark or Therese, any questions?
No, none, thanks.
Okay, old business.
You were going to talk about
Do we have anything right now?
policy?
Um,
I don't know.
You know, I would, we still have this telecommuting policy, technical guidelines, employer agreement form on this that we've not moved forward yet. I don't think we've dedicated the appropriate amount of time to it yet in any way, shape, or form. But has anybody taken the time to read through this? And should we be taking a look at it? Raj, have you looked at this at all? Oh, okay. Okay, rather than discuss it this morning, Deb, Chris,
You asked a question, I read it.
you read it. Has anybody else taken the time to actually read through it yet?
We haven't shared it with the committee or anyone yet.
That'd be a really good reason why nobody's looked at it. If we could get this out to the committee, I apologize if I was supposed to do that and didn't, I apologize. But again, let's just get our arms around it once and for all and say, hey, this is how we want to work with it and work through it. Mr. Kaios, have you? Okay,
We
I
would
just want
share
to
it.
make sure that not beyond the committee, if any, well, Chair's not on a committee either. No, let's make sure that we, you know,
It hasn't left
okay,
and gone out.
super.
yet.
Let's get, if we can move that forward a little bit so we can have a discussion. New business. Bill, you want to walk us through?
The resolution?
Yep.
I have 2 resolutions for the committee, and it is to hire a human resource generalist who will be disciplined in workman's comp and, again, all of the human resource practices. And then there is another one to bring in a part-time human resource coordinator. This person will be responsible for the clerical support in order to really help us. We have so much filing, we have so much shredding, we have just so much work in HR that we have taken the opportunity that I have strategically, as you know, aligned the organization to have senior HR generalists with disciplines, and then my entire team is cross-trained. We have dissolved the position of the assistant director, and she has moved on to the sheriff's department. And so now we have the opportunity to align it with the efficiencies of senior HR generalist with disciplines in onboarding, workman's comp, FMLA, benefits, and an individual who would be there part-time to help file and shred so that the senior HR generalist can be effective and efficient in the impacts that they have to do on a daily basis. We are a very, very busy department.
So is it fair to say that in a way, this allows you to replace people, but in a different capacity? You're not adding additional staff.
No, sir.
You're trading out.
Yes,
But
sir.
with the changes that we've made within the department, the old footprint doesn't work and we need to,
Absolutely correct.
does that,
Yes.
does anybody have any questions on that? Did I explain that okay? Bill?
Yes.
Make that
you know,
more
I-
eloquent, please.
No, I think you did a great job. The other thing that I think needs to be pointed out, both of these hirings, both full-time and part-time, are within the budget. So we're not asking for any more money,
No, sir.
requiring any more money. So, and I think the reorganization is a good thing.
Thank you.
Bill, I'm sorry, were you going to move that forward?
I would be happy to. Yes, sir.
We have a second. Deb seconds. And I
Is this for one or both of these?
I
both?
think we have to do, can we do them together? Just do them separately with a
All right,
vote.
yeah, I think it's a good idea.
Okay, so separately, yes, so do them separately. Is there any discussion on this? Teresa or Mark?
Nope. No discussion.
Davis still awake? Okay, please call the roll.
Allen.
Aye.
Ferrero.
Ferrero, yes.
Davis.
Davis, yes.
Leonard.
Yes.
Yes. And Mark, would you like to motion for the part-time position?
Sure, I'll make that motion. And just a
Second.
quick question, was it Susan Brown that has moved to the sheriff's office staff? Is
Correct.
it- Oh, okay,
Correct.
thank you.
Yes. Okay, Mark's motions. Deb seconds. Any discussion on this? And still, the young lady that is doing the phone calls in the Batcave, Nancy, is she filling this position or are you going?
We're hoping.
Okay, okay. And Nancy has been I mean, can I use the term floater? Is that appropriate? She's part-time.
She has
but
been a
she floats
floater.
between Departments and
Mhm.
she's wonderful. I mean, we're blessed to have her, so. Okay, any questions on that? Call the roll, please.
Allen.
Aye.
Ferrero.
Ferrero, yes.
Davis.
Davis, yes.
Leonard.
Yes.
Burgess, yes. I think our final resolution is a housekeeping matter.
Yes.
So you want to walk us through that?
So the per diem rates for January 1, 2021 have remained the same, but we have to have our housekeeping of the resolution. The rates are, as you can see, for breakfast, $14, lunch, $16, and dinner's $31 for a total per day of $61.
Bill puts that on the floor. Do we have a second? Deb? Any discussion on these? Seeing none, call the roll, please.
Allen.
Aye.
Ferrero.
Ferrero, yes.
Davis.
Davis, yes.
Leonard.
Yes.
Burgess, yes. Okay, Bill is motion to place the reports on file. Deb is second. Any conversation on that? Okay, if we can call the roll on that one.
Allen.
Aye.
Ferrero.
Ferrero, yes.
Davis.
Davis, yes.
Leonard.
Yes.
Yes. There's no need for executive session unless somebody has something they'd like to discuss? No? Okay. Pardon me? Yes, we just did reports on file. We're good.
Motion to adjourn?
Motion to adjourn by Mr. Davis. Second by Mr. Leonard. And this is a voice, any conversation there? This is a voice vote. Call the roll.
We don't have to.
You don't have to. This is A or nay?
Right.
All in favor?
Aye.
Woo! Opposed?
Aye,
Aye.
yes.
Thank you, guys. Have a great day. That's 29 minutes.